taking a session for the nurses specifically. I have mentioned in many of my previous discussions about the role of nurses in neonatal care as a whole. Any physician or any parent should be very thankful for the care that is provided by the dedicated nursing team. I'm very lucky to have, to have worked with excellent nurses right through my career. Obviously, some of the postnatal or the neonatal nursing staff, as well as those working in the delivery rooms, are extremely dedicated, very knowledgeable, keen to learn, and obviously empathic as well. And in terms of dealing with newborns, we have these categories. So those who work in the delivery room, some of them are trained midwives who actually manage the mother, and they may help with the management of the baby. They're all NRP trained as well. We have the nurses working in the labor room who function as a support mechanism for the midwives. They are also NRP trained. They deal with the initial assessment of the baby. They are NRP trained. They can help with the resuscitation, and they help with the skin to skin care, breastfeeding, and the additional measures monitoring after birth. We have the postnatal nurses. I mean, these are the nurses who work in the postnatal ward. They look after the mother and the baby after the delivery for the first 2 to 3 days till the mother goes home. They have a big role in monitoring the baby's vital signs. We have the newborn early warning score, which guides these parents and guides these nurses in understanding whether the vital signs is in the green zone, which is the normal, the amber zone, which indicates a quick review, and the red zone, which is an alarm level, which will need immediate physician review. So the newborn early warning score, if your hospital has not already introduced it, please introduce it for these nurses. The baby-friendly initiative and other measures to encourage breastfeeding is very important for this group of nurses as well, because a lot of time is spent on helping the mother to latch, making sure the latch is good at the beginning, helping them to hand express or use a breast pump to express. And if the baby has risk factors like monitoring the blood sugar, monitoring the bilirubin. So these are guideline based, and if you have a clear guideline in place and educate them, most of the time they can follow these steps and inform the physician if there is abnormality going out of the range. And the third category, obviously, is the neonatal intensive care nurses. And the neonatal intensive care has 3 levels of care. We have the actual high level or critical level care, which is what we call the level 3 care. This is the sickest babies, the smallest baby, 1,500 gram in the first few days, or less than 1,000 gram till they cross that weight. The babies who are below 28 to 30 weeks gestation in the initial few days till they're on respiratory support. Any baby who needs ventilation through an endotracheal tube. The tiny babies, even if they are on non-invasive ventilation. Any baby who needs umbilical lines or parenteral nutrition. A baby with birth asphyxia having seizures or having cooling treatment. A baby who is moribund or close to dying because of a very severe situation. All these come into the level 3 care. And the level 3 care is provided by the most experienced nurses, very skilled. In the UAE, the nurses do the cannulation, help with the procedures, arterial sampling, and so on. In the UK, where I initially worked in, the nurses weren't doing the procedures, but as I was leaving, the advanced nurse practitioners came in and they started training the nursing colleagues to do some of these as well. So naturally, they've been doing it for a long time and they're expert at these procedures, and that saves doctors a lot of time. And in terms of infection control and things, obviously, the same nurse handling the baby doing the procedures helps minimize the spread of infections within the unit. The second level of care, high dependency care, is when the babies step down to more of non-invasive ventilation and the support of the care. In terms of this special care, that's the lowest category of care in the neonatal unit. All the care is usually provided in the same unit, either within the same area where the same baby steps down from intensive care to lower level of care in the same bed, or they may move beds according to the size of the unit. You may spread them out. The special care nurses and the postnatal nurses may overlap in some of the units according to the staffing situation, but the intensive care is provided by experienced nurses in that specific field because these are high risk babies where a simple fault may lead to more problems, and infection control is a huge issue in the neonatal intensive care. Everyone has to look into that as well because if you avoid infection, half the job is done in terms of a good outcome for the baby. In terms of what the neonatal nurse should know, so I mentioned that in the postnatal nurse, the or the labor room nurse, the main thing focus is on identifying the vital signs to be within the normal range or out with the normal range, how to support the breastfeeding, and how to assess the sugar, or how to assess the transcutaneous bilirubin. Be aware of the guidelines that regulate these and go by the guidelines and document appropriately. Empathy communication is important. They need to be aware of the screening modalities that we do for all the babies. So we have, I can share the lecture I did on newborn screening. So we have the newborn hearing screen, we have the newborn critical heart disease screening, the blood spot screening as well. So the jaundice and sugar monitoring can be considered screening as well. And of course, the physician does their clinical assessment and documents the full checkup. If any problem like a murmur or other issues are found, they will be mentioning it. So the postnatal nurse has to identify problems and feedback to the doctor. The well-being of the baby, obviously, with experience, they know that the baby is sick or not, and whether the baby needs a quick review. But the news chart I mentioned can guide them. The intensive care nurse has to know more. They need to know the equipments that are used in the NICU. There is competence-based assessments. There is training for them when they train to be, and also yearly or once in 2 years, according to the frequency of the procedures. They need to be well versed in sampling. They need to be well versed in communication on certain aspects, and of course, monitoring the baby is very important. Support of the baby on non-invasive ventilation. So the success of non-invasive ventilation depends a lot on the skill level of the nurses. If the nose gets blocked, again, the non-invasive ventilation is not effective. So using the right size of nasal interface, making sure the humidity is connected appropriately, all this is important to ensure, and handling the baby in appropriate way. We call it developmentally supportive way, clustering of care, all this helps as well. And of course, most of the neonatal intensive care nurses are keen to learn more. They support the physicians a lot. They trigger the suspicion, and if a nurse brings out a suspicion, don't disregard it at any time because they are by the bedside. They often listen to the mother as well, and they get the feedback. We can train the nurses in looking at the ventilator graphics and the trends, and also to decide when to do suction and so on as well. So my sincere thanks to all the neonatal nurses uh, who are delivering great care to the babies. I have a lot of information on my channel which will help you, so I hope you can share this information. In this session, I didn't cover the nitty gritty of it, but hopefully, I'll do a few more sessions for the nurses. And thank you, everyone.